Chip, can you mute yourself? You're on your telephone.
Trying to find him in the list here.
There you go. Thanks, Dan.
All right, let's get started. Welcome, everybody, to the Older Vermonters Caucus. Today we have representatives of our congressional delegation to kind of give us an update on what's going on in D.C. But before we get started, I thought that if there was any legislators here that are working on any legislation, I know we got the deadline coming up here at the end of this week, so just figure I'd open the floor if anyone has anything that they wanted to talk about. But if not, we can get started. I'll just give we were talking about this earlier, that in the Human Services Committee, which you can find on YouTube, we were discussing about the home and community-based providers in our budget discussions today, as well as yesterday we had a walkthrough on a couple of bills that affect older Vermonters that you can find on our YouTube channel on the Human Services page. The increase on home and community-based providers was the bill that Teresa and I introduced, and then also looking at senior nutrition. It was nice to have Jenna Claire there and Janet, to give an update on what's going on in nutrition around. So you didn't come here to hear me, so I will turn it over to our congressional delegation. So we have Beth. Hang on, let me get to my list here. Sorry. I'm sorry.
Polly.
Polly, that's what I thought.
Yeah.
Okay. And to theme. Did I get that right?
Perfect.
All right, perfect. So I'm not sure who wants to go first, but I'll turn the floor over to the three of you, and maybe we could just get an update, and then maybe open the floor for some questions and comments. So thank you all for being here. Really appreciate it.
Well, thank you, Representative Noyes, for inviting us here today. I'm Polly Major. I cover Human Services for Senator Leahy's office, and when we give updates, we go in order of seniority. So I get to start, and then I can hand it over to Beth and then to Fian. But we're really glad to be speaking with all of you today and just giving a snapshot of everything that's happening on the federal front, and also hearing from you about what you're hearing from your constituents and where the needs are and what we should bear in mind and bear back to our bosses as they take up new legislation in this current Congress. So I usually start with an overview of where we're at with federal funding. Senator Leahy's now chair of the Appropriations Committee. He's very happy to be there. And in December, Congress passed an omnibus spending bill for fiscal year 21, our current fiscal year. And that bill was the second, we were in the second year of a 2-year budget agreement. So we didn't have a lot. Someone mentioned making the pie bigger. We didn't have a bigger pie this year. We had a pretty similar sized, we were working within pretty similar sized budget caps as the previous year, which meant that the program levels were funded at largely the same levels as the last year, with some modest increases. And if you remember back to the kind of DC debate in December, there was a real push from some in Congress, though not our bosses, to separate out COVID response from the federal budget. So I'm going to just talk about the federal budget side of what we did in December, and Beth and Tafine will touch a little bit on the COVID response bill that was passed in December and the next bill that we're working on now. So to get into a few specifics, the Administration for Community Living saw some increases in Older Americans Act programs. You mentioned nutrition earlier. Congregate nutrition saw a $5 million increase nationwide. So again, that's not huge, not what it needs to be, but it is positive movement, especially if you remember the context that this was a budget negotiated with the Trump administration that wanted to cut many programs. So Congregate meals saw a $5 million increase that was funded at $515 million nationwide. And home delivered meals saw a $10 million increase, and those are funded at $276 million nationwide. Supportive services, I know we spoke with Janet Hunt and her group with the AAAs last week, I believe, about the need for supportive services and senior centers. Those saw a minor increase, 2 million nationwide. So this is showing that Congress is committed to these programs, but we know they're not funded at the level to meet the need, especially in rural states where we have to get meals out to folks and really serve many small towns so our seniors everywhere can access these senior centers and the services they provide. Another program that I wanted to touch on, because it's one that Senator Leahy is very supportive of, is the State Health Insurance Assistance Program. That was level funded last year, but we know with the pandemic and the changes in insurance, that's a real critical program for our seniors across the state, and one he wants to continue to support and hopefully see increases in moving forward. I think I'll touch on HUD because I hear about the need for senior housing a lot. And one of the main funding streams for senior housing is called HUD 202, a really splashy title. And that supports the development of senior housing. And there's been some new money for capital for development in that program. And we're working with Vermont partners to see if there are projects on the ground here in Vermont that as a delegation we can support and help access that funding. So far, the timing of when the dollars are available and when projects are ready to move forward hasn't lined up. We're hoping to see more alignment moving forward there, and really going to focus on meeting some of that need for housing across the state. The other item I wanted to touch on was in the USDA's budget, the Commodity Supplemental Food Program that also helps reach seniors. And that saw a sizable increase from 275 million to 325 million over the last year. So a lot of focus there from the federal government. And kind of as we close the book on fiscal year 21, we're also looking ahead at fiscal year 22. It'll be here before we know it in October. So we're interested in hearing from you about the needs in the state and which federal programs Senator Leahy should have on his radar as he leads the committee through the negotiation processes to put together the spending plan for fiscal year 22. So I think that's enough numbers from me, but always happy to hear feedback. I'll drop my email in the chat so you can see that as well. And I'll turn it over to my colleague in Senator Sanders' office, Beth Stern.
Hi, thank you. When Polly mentioned we go by seniority, I want to clarify it's seniority of our bosses. Because if you went by seniority of us, I would be last since I just started this job 3 months ago. For those of you who knew me from my previous life, I was at Central Vermont Council on Aging for 30 years. So this has been a change for me, one I'm loving, but also missing a lot of the people that I used to work with, but glad to see everybody here. So I cover for Senator Sanders seniors, disability, healthcare, and poverty issues. I also have a focus on the Northeast Kingdom, and post-COVID, I'll have an office in St. Johnsbury. So I wanted to talk about some of the COVID money and the COVID bills that are happening and have happened in the past. And just say that, as you probably have read, the Senate passed the budget resolution recently, which is allowing the budget reconciliation process to move forward now for this next COVID relief plan, which is at currently $1.9 trillion. The last COVID relief plan in December, Vermont received about $840,000, which is the small state minimum. And most of that was for meals, home delivered meals. The new COVID relief plan, which hasn't passed yet, but is working its way through, does include increased funding for older American programs. And the total at the moment is about $1.4 billion for Older Americans Act programs. So about half of that is in nutrition, about a third is in supported services, and that also includes some vaccine distribution outreach, and also services to prevent social isolation. There's some money in the National Family Caregiver Support Program and some in health promotion and disease prevention. And so Senator Sanders is working really hard to make sure that this plan is as robust as possible and has as much in it as we can get through. Right now it's in the House, hasn't moved over to the Senate yet, I don't believe. And as Polly mentioned, the fiscal year 2022 budget process is also starting now. And so that offers another opportunity for advocating for funding for services for older people. And that will be something that I'm really interested to hear about from you all. What kinds of things should we be focusing on in the fiscal year 2022 budget? So I'm going to stop there because I know we'll have some questions later and turn it over to Tafine.
Hi, everyone. Thank you for having us. My name is Tafine Dean, and I cover human services, healthcare, housing, and racial and social justice for the congressman here in Vermont. I've been at his office for about just maybe over 2 years. I'm not quite sure. The pandemic has been rather long. So, I love going after my colleagues because they've shared all the big numbers and I don't have to remember them in my head. So I'll just say, from the congressman's perspective, in terms of moving into the new Congress, he is continuing to stay focused on our senior issues. Affordable healthcare is high on his list of priorities, and that is through HR 3, which was a bill that was passed the year before, on prescription drugs pricing. That is a huge priority for him and continues to be. And I know Senator Leahy has the sort of corresponding package in the Senate, the CREATES Act. So we will continue to focus on affordability through prescription drug reform. We will also continue to focus on food programs for our seniors. Congressman Welch recently went on a wonderful meal delivery program with Age Well, so thank you. And we understand the need for getting good quality food for our seniors and continuing to fund those programs to the best of our ability, really. And with that, I think I will wrap up because I think I'll just let folks ask questions. I know that there might be some questions, so I'm happy to answer those.
Great, thank you so much. We did have a question. Representative Toriano, do you still have a question? I saw your hand up earlier.
Well, sort of. I was muted for the first part of the conversation, but the question for Polly, who presented this homeless rental arrears funding to our committee a few weeks ago. And I was wondering if there was any information or leaning toward the guidelines. We all spoke about how strict they were, and we've had Commissioner Hanford in and a number of people trying to figure out how we can best apply this money and spend this $200 million before we have to give it back. So has there been any changes or progress to that, Polly? That's my question.
So short answer is we haven't heard anything new out of the Treasury. Last week, as a delegation, we sent a letter to Secretary Yellen articulating some of the flexibilities that we've heard from conversations with the legislature and with Richard Williams and with Josh Hanford. And I can share that letter with the group after I'm out of the spotlight here. So we sent that in on Friday. And I also want to bring up that Senator Leahy did have a call with Secretary Yellen. It was a kind of brief welcome call, but he did make sure to mention the rental assistance program and the need for flexibility. All that said, we are working in this bill within the confines of the reconciliation rules, which means that we can't easily go back and amend past statute. We're not going to be able to change things like the deadline for that 200 million or the income limitations or any of the authorized uses that are set out in the statute. So while we are hopeful that the new administration is going to broaden the parameters of the program within the statute, they are bound by that statute. So it's going to likely still need to go out the door quickly and for rental assistance, and we'll continue to push for capital from construction because we know we can have all the vouchers in the world in Vermont, but we don't have all the apartments for them. And that's, we understand that's critical for the state.
That's true. I mean, as far as in connection with this caucus, you know, older Vermonters on Social Security would certainly qualify, Social Security only would certainly qualify for possibly rent forward payments for the next 6 months or something, and be really beneficial to get folks through the winter and the heating season. So that's what we were hoping for.
Great points, Chip. Thank you for bringing up housing. It's definitely something that's on our minds. I'm just going to jump in with a quick one. I understand that the National Service AmeriCorps programs, the funding has pretty much doubled for that in the proposed. And I don't know if anyone wants to speak to that. I guess it's gone from a $1 billion federal agency to a $2 billion federal agency. I was just reading something about that. And I know that that might be a really good way to help with older Vermonters around housing. If we can build some AmeriCorps programs into Vermont that work with individuals. So I don't know if anyone wants to touch on that, but
I think we're still kind of watching that money work its way through the legislative process. I did touch base with Phil at Serve Vermont last week, I believe, and he was very excited about the possibilities for that funding here in the state. I'm an AmeriCorps alum, so I was thrilled to see it as well. And one of the things I think we're going to be looking for is to give the state commissions the flexibility they need to respond to upcoming needs. So Phil and I have been talking about that, but I don't know exactly how the kind of doubling of the program is going to impact the volunteers and members here in the state.
Is that, Dan and Polly, because I wasn't aware of this, is that through the COVID bill? And is it time, my question would be, is it time limited so that, you know, after a year or 18 months, it goes away and goes back to the previous level, which would be challenging, I think.
It is, it's in the reconciliation bill in the House draft. And I believe it's a 3 or 5 year, I think it's a billion over 3 or 5 years, but I don't have those details in front of me.
all right. Thank you. I just had talked to Phil myself and got that piece of information. So it'll be interesting to see how that plays out and what impact that has on Vermont and on national service in Vermont. So, all right. Anyone else have a question out there? You can raise your hand or.
Hi, I know that Jim had sent in a message, a private message about a letter he sent in to our offices about, Jim, I believe it was Medicaid reimbursement for, sorry, Jim. I don't think I've read through the entire letter, but I think it was flagged just prior to this meeting.
Yeah, I'm just thinking
right.
What are your,
well, thank you for, our concern is, well, I'm speaking representing Living Well Group at the moment, though I'm also president of Cove. So choices for care, the reimbursement, Medicaid reimbursements, we were concerned that overall those rates aren't meeting the needs, especially during COVID times. But we really wanted to, you know, earlier I made the joke about expanding the pie, because we don't want to take from any of the other valuable stuff that Medicaid covers, but at the same time, our seniors who are in residential care facilities, long-term care facilities, Medicaid rate, it's hard to staff properly and just work with the rates that we have. So we really wanted to emphasize that. And then the other point that I want to make sure was thought about by the the delegation is that in our facilities, we have a few residential care facilities. Let me just turn down another thing here. Sorry, trying to be in 2 meetings at once. It's not easy. So the other one is that that we succeeded in keeping jobs, and we succeeded in keeping our residents clear of COVID, and we received support in the first round of money, and that support meant we succeeded. The trouble we're worried about is in 21, we're still in COVID times, but we didn't fail enough to now receive funding. They're the same kind of funding as we had before. So in a sense, the letter spells it out from our director, our executive director, Jeffrey, who's also on this. He can speak to it a little bit better. But I think about it from a larger picture of the statewide, that what about the programs that did well and now are not included in the December federal money? It means that we did what we were supposed to. We kept people safe. We kept jobs. But really, in order to qualify, we needed to have failed by essentially worse than 25%, and we didn't. So our reward for using the money, using it well in this industry, might be that we don't get support in 21. And so I'm wondering if the delegation can relook at long-term care and making sure that there is some funding to support that as well. So thank you for giving me a moment to speak to that.
And Jim, I'll just add in, if I may. I'm Jeff Lindemer, and I'm the current executive director of Living Well Group. Jim and I signed that letter, and I sent it to each of the members of our congressional delegation today. And I just got your email addresses, so I'll make sure you each have a copy of that letter after this call. And it does address two things. It's the lack of adequate Medicaid funding and the I'll call it a penalty, for lack of a better term, a penalty for our success in COVID. We do need assistance this year. There's no question we do. But as the rules are written at the moment, we don't qualify for assistance. So I'm hoping that each member will think about the rules so that we can get some additional relief this year. Thank you.
Can I add to this question just so a little bit? The earlier CRF funds allowed states quite a bit of latitude to determine what was necessary at the local level, at our statewide level. And the December package definitely did not. You know, there was definitely more prescriptive in terms of what, and you know, the assistance in those areas is great, but we're hoping that with a new administration, that they revert back to allowing the states to have more latitude in determining what the needs are at the local level. And that is really of significant concern to us here in Vermont. And hopefully through, we enjoy the seniority what seniority brings to our state in terms of all three of our congressional delegation members, and hope that you can really look at that flexibility being at the state level instead of being so prescriptive at the federal level. So that would be sort of one way to really address what Jeff and Jim were just speaking of, because we would definitely prioritize long-term care at the state level. And then while I have you, I'm just going to throw out another thing. This is more of a longer term thing for you to think about. The formula for calculating the federal share of the Medicaid program is woefully out of date. And it really needs to be reviewed. And I realize that's a big undertaking. I know how big that is. But one of the things I want to put on the table as it sort of, an out of the box thinking idea is the potential to have a differential rate for Medicaid That has been done on a time-limited basis in some instances, with higher FMAP rates and things like that. I'm specifically thinking of home and community-based care for long-term care services, and a higher federal share for that, particularly because we, in Vermont in particular, we're saving millions of dollars every year. We were just looking at our budget, and just in 1 year, we're projecting a $6 million savings by a reduction in the Medicaid usage of nursing facilities. And so, if we were able to capitalize on supporting our community-based service providers to a greater extent by, perhaps an enhanced FMAP, we would be able to give those COLA increases that they haven't had for a long time. So that's sort of an out-of-the-box kind of thinking idea to take back to our delegation.
Thank you, Representative Wood, and thank you, Jeff and Jim, for flagging that. That is really important, and continues to be a priority for the congressman. And I just downloaded the letter, sorry, and I read through it, and the issue, as Representative Wood, as you mentioned, the FMAP previous packages have included FMAP increases to help during this time, but we did not see that, I don't think, in the December package. I'm not sure, maybe. And I know in the new package, the FMAP increase is only related to vaccinations. So I point taken, and I will pass that along to the congressman. Absolutely. The one other thing I wanted to mention was the, it's completely left my mind. I'm so sorry, but I'll come back to it. Sorry, I won't.
Does anyone else want to address those issues?
I can.
All right. Polly?
Briefly touch on the beginning of your comment, Representative Wood, about the CRF funds, and say that's something that's been a priority for my boss and for the delegation throughout all the negotiations on COVID. And the December bill, it was a bipartisan, middle of the road package, and we're glad we got something done, but it wasn't perfect. And so we're going to continue pushing for CRF funds because we know how Vermont's done a great job putting those flexible funds to good use.
And that's it, Polly. It's the flexibility of the local and state funding. I know that the congressman is definitely pushing that out. And I'm not sure if our state director, Rebecca Ellis, had shared some of that, the initial information that we got in terms of what the local and state funding would be. And that's the kind of flexibility dollars that we're really pushing for. Thank you. Sorry about that.
And I had a question around the what Jeff and Jim were talking about with not qualifying for a second round of money. Was that under the PPP loans, the Paycheck Protection Program, or was that a different pot of money?
No, that is under the PPP program. We had to show a 25% decline quarter to quarter, 20 over 19, and we didn't show that. We didn't. We didn't fail enough to, and the 25% seems, well, obviously seems arbitrary. So I'd like, that caught us. Okay.
Yeah. No, I just wanted to clarify that. I have heard this come up from different folks and different businesses as well, is that it's become more challenging to show that in order to qualify. So I'm taking a lot of notes here so that I can pass this on up the up the alley here to other people in DC from Senator Sanders' office to make sure that they're aware of all of this.
Next up, we have Ruby, and then Jana.
Hi, my name is Ruby Baker. I'm the Executive Director of Community of Vermont Elders, and we have usually really focused our advocacy work on what can be done with state legislature and within the state. Of course, always excited to hear from our congressional delegates. But recently I started talking with some folks from Maine and New Hampshire and trying to think about some of the issues that are affecting sort of the northern tier more extremely than perhaps other parts of the country. And I'm one of the things that comes up again and again and again, and we're trying to address it here in Vermont in our own little way, but what I feel like we really need is a coordinated effort is workforce. We have, I think it's 5,000 open nursing positions in Vermont today. 5,000, that's a huge, huge number. And the average age of nurses in Vermont is 61. That number is not going down. We are really, really in a desperate situation in terms of workforce, not only for nursing, but caregivers. Talk to the AAAs, talk to the visiting nurse associations. We are in dire straits. And and when I talk to New Hampshire, when I talk to Maine, they're also in dire straits. This is a huge, huge problem. And as the Northern Tier is the most rapidly aging portion of the state of the country, it's only going to get worse. So what I feel like might be really helpful is sort of a coordinated 11-person effort, if you could make it happen, to get all of the delegates from all 3 states and other states who are facing similar challenges to say, hey, we have to address this. It's not, each state can't handle it by themselves. So I don't have any answers, but we need help from the federal level to address the workforce challenges that we're facing. And if you can use your collective creative brains, that would be so helpful.
Right, does anyone want to respond to that? It's definitely going to be a topic of an upcoming Older Vermonters Caucus. We will be talking about workforce, no doubt about it.
Absolutely, and it's especially nursing education and nurse workforce is an issue that's near and dear to Senator Leahy's heart because of Marcelle and her being a nurse. So we've certainly supported funding for nurse education over the years, but it's not enough to get us where we need, and we need it both to be investments in training, but also investments in attention and in pay. So I think that needs a multi-pronged approach, and thank you for your suggestion to work across the region on a strategy there.
Great. Next up,
Thank you so much, Ruby Bickett. Sorry, Representative Noyes. The congressman did host a nursing workforce roundtable, and Laura Pelosi, who I know you all work with quite closely, released that report about the nursing workforce shortages, and that was one of the things that he's really been focused on. And I really love the suggestion of working with as a sort of Northern New England delegation coalition, and thank you for that. That's a great suggestion, and I'll definitely take that back. And this has been, one of the things that we had talked about at that roundtable was just the fact that there's such a pipeline issue. I mean, it hits at every single angle, from like the number of trainers we have to train nurses to the fact that we can't get enough to the output. So it's an issue that is absolutely front and center for us and a priority.
And I know that, as you know, Senator Sanders is working hard on raising the minimum wage, which I think with some of the lower paying professions that you're talking about here, not necessarily nurses, but the caregivers might help in that way. And I know that there are secondary implications of this. And so you can't just raise wages without raising the funding to support the wages and some of the programs. And so I'm working hard to talk to the other staff members who are working on this in DC to make sure that it's not just about the wage, but also about the programs that pay the people who do the work. So yeah, there is no good answer on this one, but it is definitely a problem that Vermont and other states are dealing with.
I would add, I mean, I hear mentioned Northern Tier. We have needs in the middle of the state and in other parts as well. So, I mean, I hope that the idea broadens as best as possible. But the other is to think about the ladder, that it's not just the nurses at the top. It is the ladder of various levels of skills. And that is another one of the challenges we see in a lot of facilities, is the the ability to find enough people at any level, whether it's nurses or on down. And I know workforce is going to be a tremendous problem across many sectors. So you do have to be creative.
Great, thank you. Next up, we have Jana.
Hi, everybody. I'm Jana Clare. I'm the director at Montpelier Senior Activity Center and co-chair with the Vermont Association for Senior Centers and Meal Providers. And I want to thank Teresa and Dan for heading up the conversation yesterday with the House Human Services Committee about senior nutrition funding and the situation, and for everyone else who testified in support of that. It was a good conversation. And some of us on Bass Camp have been in conversation with Beth recently about senior center and senior meal funding. So I really appreciate Beth, Tiffine, and Polly coming today. Something else, and I have an understanding that there could be further Older Americans Act support to that in the future, as well as perhaps, hopefully, more some new state funding if we're fortunate enough for that to pass. What I want to raise today is just another perspective on meal funding, and to remind everyone that Meals on Wheels are a really frequent part of discharge planning from hospitals. And older Vermonters, often our most vulnerable citizens who are getting out of the hospital and told to get Meals on Wheels, in addition to maybe OT, PT, get those services because of the providers doing them, but the funding to support them is usually a third or so of the cost. So the burden isn't getting paid by health insurance the way the other discharge planning services are. They're getting covered by senior meal sites fundraising, and it's a big burden, and the need is growing. And it's healthcare that's not being reimbursed as healthcare. So another place I encourage you to look at possibly finding funding is in the healthcare realm. That's a complicated zone that I don't have great understanding about, but perhaps patching together different sources could better fund these important services. Something else, part of healthcare, that I hope is being considered or will be considered, especially with the pandemic teaching us a lot, is the importance of technology for older Vermonters. As many of you know, some people have been able to pivot to telehealth during the pandemic, and this is allowing them to get the service that they need, and frankly, for hospitals and healthcare providers to better afford and be able to serve more people. However, there's still a lot of people who have a phone and don't have a device, or if they have a device, they may not have broadband Wi-Fi. Even if it's available in their rural area, they may not be able to afford it. And even if they can afford it and they have the device, they may not have the training to use the technology. So I think everyone knows this is an issue, but in so much as it will support the healthcare industry, even post-pandemic, to be able to provide telehealth and to have perhaps smaller facilities to provide healthcare, I hope that will be considered. And I just want to add too that telehealth technology also allows our older Vermonters to access socialization from remote location. So those who are never going to be able to get to a senior center or out to community sites where they can interact with the right technology, training, and Wi-Fi will have the ability to have less social isolation. So we're learning a lot during the pandemic, but I think a lot of these things are what we need to pay attention to even when things get back to normal eventually. Thanks for considering this.
Great, yes, and I just want to point out that I have been emailed with Beth on allowing internet to be part of like the Medicaid, to be able to pay for it so that we have greater uptake as we try to bring CUDs, the communication union districts across Vermont. So almost think of it as Lifeline for older Vermonters and be able to be included. So I'm not sure where that's going, but I threw it out there, and definitely I think we'll be talking about conductivity and Internet of Things coming up in one of these caucuses for sure. So I'll let our guest answer.
I don't mean to come in here. I was going to share a link that the congressman reintroduced a bill from last year for the extension of the public health provisions that Medicare reimburses for audio-only telehealth services. So 90 days post the public health emergency, and also looking at research about the benefits of telehealth during the pandemic and making those changes permanent. So I'll add that link to the bill that was introduced last week or the week before, maybe, in the chat box. But I just want to say that's on our radar for sure. This pandemic has really showed us the how important telehealth is, especially the audio only. I know is so beneficial for our seniors. So thank you.
Great. We got a Representative Page. I believe you're up next.
Oh, thank you. Just a couple of things. I actually serve on the Healthcare Committee, and we are working on the telephone audio health aspect, where the payments would remain the same for inpatient visits for the time being. And then also I want to discuss the workforce issue. As you said, we are suffering from a lack of healthcare workers, the northern tier, but throughout the country actually, and we're competing against everyone for those bodies basically. And I was just wondering, and our healthcare committee is looking at these things, trying to attract more healthcare workers at all levels into our state. One of the things that we're looking at is scholarships to attract people here. And I was hoping that maybe our legislators down in Washington could maybe look into that. And then also, as a result of having so few healthcare workers here, we're doing a lot of contracting with traveling nurses, which is, as you know, is extremely expensive for our hospitals. And maybe some assistance could also be applied there as well to help offset some of those costs. So thank you very much.
So thank you for that. You probably know Senator Sanders is a big proponent of the federally qualified health centers. And one of the things that I think he's been working on is trying to expand the loan forgiveness programs that at this point, I'm not sure if it's just doctors or if it goes into nurses, but at least doctors can take advantage of if they work at federally qualified health centers. And that it's been fairly limited in terms of numbers of people who could qualify. And so expanding that would be one small way of getting in at least people at that levels. But I'll check and see whether that expands into other medical professions. I don't know, maybe Polly or Tafine, you know that.
I'm not sure, Beth. I can check. My understanding is just physicians, and mainly primary care physicians, but I'm not quite sure.
It would be great to see if something like that could get expanded into into the nursing profession as well, because as you know, we've all talked about, the shortage is pretty dramatic in nursing, but also we're looking at a crisis in physicians as well coming up in Vermont, I think.
Next up, we have Jane.
Thank you so much. Just a couple of points I wanted to raise. Just with regard to Representative Wood's comments on the community-based service provider investments of the future, I think it's really important to move in that direction. It's the value that the community and home-based providers offer financially. You know, if I can just share some snippets, for the same kind of investment for a year on a meals program, for example, is the same cost as a day in hospital or 10 days in nursing homes. So we know these are really compelling figures, and the more we can invest and start to shift our focus to providing investment in home and community-based service programming with year-over-year rate increases that are sustainable and reasonable, not just for meals programming, but for care management programs and other. We're also seeing evidence that care management programs are making a difference through the work that we're doing at One Care to keep our older adults at home and reducing avoidable ED visits and readmissions to hospitals. And that data is starting to show traction for anyone who's been care managed for more than 6 months and tend to be very high risk clients. So I think all of this discussion around how we transform our programming support is really important, especially as we think about federal funds and the state funds that can support our work.
Thank you. Does anyone want to respond? All right. Representative Toriano.
Thanks, Dan. I just wanted to comment a little further on what Jenna had said. Social isolation for our older Vermonters, particularly in Vermont, it's been on my mind for a long time. Dan and Teresa might remember my years on human services. I used to discuss it all the time. I watched my father go through it when he outlived all his friends and had no one to socialize with. So, and I watched the decline of his mental health as a result of it. But I wasn't on the other side. I was really encouraged when we had a report from the Bennington Veterans Home to tell us that their residents, there are about 96 residents right now that have all become really computer savvy and have avoided a lot of the social isolation as a result of COVID and being restricted to their rooms. So I was encouraged by that. It is capable. I'm a Luddite myself, but I really have had to step up and get into this Zoom thing and make it happen. But I think with a little bit of education, we would go a long way to help our older Vermonters get out and about on the internet. And I think it's a really, really important piece. So, thanks for bringing that up. I appreciate it.
Great, thank you. All right. Anybody else have a question or a concern they want to bring up?
I just saw Ruby's post about hearing aids. Medicare coverage of hearing aids.
Yes, please.
Look at all the heads nodding up and down. Medicare coverage of hearing aids.
Yes, absolutely. I have so much data I could share, but the pieces that we're really focusing on right now are the very strong correlation between untreated hearing loss and increased rates of Alzheimer's, which is much more expensive to treat than buying a pair of hearing aids. Also, falls. Older adults are at higher risk of falling if they have untreated hearing loss. And that connects again with many of the state's priorities, but also national priorities of fall prevention and reducing ED visits. And the list goes on, but those are the two big ones that pop into my head, in addition to social isolation and the mental and physical health consequences that have been proven again and again to be connected with social isolation.
Yeah, I'm wondering with the school being downtown, how are we handling things like the traffic at
Jim.
Okay, I think next up, Jana, and I think we'll be wrapping up pretty much after that. We're getting pretty close here, so go ahead.
Just following on Ruby's point and points that others were making, the investment in certain services like Meals on Wheels, purchase of devices really is worthwhile because it will save healthcare spending in a significant way if people can access what they need and stay more well. And that might mean, accessing a device so you can take an online exercise class with a senior center or a private gym, which then keeps you healthier and stops you from going to the hospital. So there really are certain investments we can make that will save the state and the federal more in the long run. So I just want to keep that conversation alive. And I was struck by the example from the VA down in Bennington, I think it was. And, I think that happened because they were all given devices and training and help. So I think there is even more still we can do as a state to coordinate around provision of devices and connectivity and training, both, among the senior centers and AAAs, and partnering with schools in many cases. There are some great examples of this starting and expanding during the pandemic, and I hope that we will have support to keep building on that.
I see your role for AmeriCorps members there on the training team.
Yes, our AmeriCorps member is doing Zoom trainings all the time.
Awesome. All right. Thank you, everybody. Appreciate our guests today coming in and talking to us, and everybody for showing up. So thank you very much, and we'll see you all next week.
Thank you.